I present to you today a cohort study regarding hematoma blocks in pediatric femoral shaft fractures. This was done at Randall's Children's Hospital as a part of Legacy Health System. In this study, we have 19 pediatric femur fractures that were taken for hip spica cast placement that received a hematoma block during the application of this cast. The point of this study was to see if we could reduce opioid use amongst the pediatric patients and potentially decrease the number of opioids that we were given the patients to go home with. The patients were consecutive in nature. There was 19 of them. We gave a 10 cc volume of 0.2% ropivacaine injected directly into the fracture hematoma from the lateral side of the femur after the patient underwent anesthesia. We then retrospectively, through the chart, looked at the intraoperative, PACU, postoperative opioid administration in this cohort. We also looked at the age, sex, laterality, fracture pattern, time in the OR, any complications, and then converted these opioid doses into morphine equivalent doses using a standard scale. The intention was then to compare them against a cohort of similar patients that did not receive the hematoma block. In this case, we had about 15 patients during the same time period from 2018 to 2020. The data we found basically that there was no statistic difference between any of our variables we measured. There was a trend towards less morphine equivalent dosing in the OR, in the PACU, and even a little bit on the floor. But as I said, nothing came to statistic significance. The big things to come from this study is that it's preliminary, it's still ongoing, we're still collecting data. Some of the earlier patients were actually given opioids post-operatively as a standard order set, which was discontinued later on, and we expect that this kind of skewed some of our early data in the hematoma block patient group. As we get more and more, we should be able to see if there actually becomes a statistic difference or not, and we will see if overall the prescription trends tend to change. Thank you.